The health commissioner said here in New York, being echoed across this country tonight, some hospitals already on the brink. Doctors putting masks in Ziploc bags so that they can use the same mask for up to a week. There are urgent pleas tonight from the front lines, and ABC's chief national correspondent Matt Gutman on that part of the story.
Tonight, cascading shortages reported at hospitals around the country. One of the most critical, blood.
Right now, we're at like a critical shortage of blood, again, common across the country, because no one is donating blood.
Clinicians telling us those N95 masks are so precious, they're now kept in Ziplocs or paper bags because they're told to hold on to them for up to a week.
My mask snapped while I was trying to take it off in between patients, and I had to staple it back.
But perhaps the most alarming shortage, doctors and nurses themselves, including Dr. Dara Cass, who tested positive.
And I was using all the protection I was supposed to. I probably just wiped the surface with my hands and then wiped my face between mask usage.
She's working from home now, urging other medical professionals to get tested. 2 Navy medical ships deploying, one on each coast to ease the burden. The USNS Mercy heading up the west coast next week, where a battle is brewing whether it will dock in LA or in Seattle. And the USNS Comfort will head to New York in early April. And the Army Corps of Engineers preparing to possibly convert the Javits Center in New York, as well as college dorms, into makeshift medical centers out of fear beds will run out in weeks. Tonight, we're taking you inside the Ochsner Medical Center in New Orleans, now using special respirator masks to protect staff. And across the country, thousands rushing to get tested. At New Jersey's first major drive-through testing site, police had to turn people away after just 4 hours. One of the nation's leading infectious disease doctors admitting the U.S. is not meeting the demand.
We are not there yet.
Tonight, the World Health Organization warning young people they're not invincible. The CDC says nearly 40% of the people hospitalized in the U.S. are between the ages of 20 and 54. And 22-year-old Los Angeles resident Beyonda Haliti taking to social media to describe how her symptoms evolved. Tonight, she says she's proof that the pandemic can impact anyone.
I just want to let everyone know that, it's very important to stay inside and follow the CDC guidelines and, take this seriously.
And just anecdotally, we're learning tonight, Matt, that there are many young people in ICUs around this country. We have to take this seriously and not have a false sense of security. And Matt, I also know there's news coming in from some sources in Washington State tonight, and really across the country and other places as well, that have echoed what we had heard early on in Italy, that at least in Washington State, they're also now making emergency plans to decide who will get treated in a worst-case scenario and who won't.
That's right, David, and that is because they are running short on supplies and they expect the number of patients to skyrocket. So in the coming weeks, they expect to have to make this brutal triage decision, essentially deciding whether or not to give the sickest patients full medical care. And doctors are telling me they're going to have to make a decision of life and death on the spot. David.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.